Hospital workers of Reddit. What happens there that's hidden that we should know about? 1. You are doing your 90-year-old grandmother a great disservice by making her a full code. She will not survive CPR, and her passing will be significantly more traumatic because of it. 2. Sometimes when people die, we just put an oxygen mask on them and wheel them through the corridors. Less distressing for other patients and visitors to think they're asleep rather than see a body with a sheet over it. 3. An ambulance ride is not a one-way ticket to the front of the line. You still get triaged and could be rolled right to the waiting room if you're non-emergent. 4. If you sit there on your phone the whole time, the mother of your child is in labor, such that a nurse has to step in and fulfill the supportive role instead. Yet everyone knows, and you're getting judged by the whole unit. 5. Some families reject death so much, they beg the doctors and nursing staff to do life-saving measures on their 95-year-old grandma who has cancer everywhere. It's just unacceptable. 6. I'm an ICU nurse. I had a patient who was declared brainstem dead. I switched off the ventilator pumps, etc., and extubated the patient. A few moments later, the patient displayed Lazarus sign, which is a reflex that causes the patient to raise their arms in the air. I was by no means new to the role, but this really scared me, as I had never even heard of it, let alone witnessed it. 7. People abusing nurses. And when the nurse is reported, nothing happens. Nurses deserve safety, and the attackers deserve accountability. 8. If you come into the ER drunk, there is guaranteed a pool of bets on your blood alcohol level. 9. That patient families will do anything to keep the patient alive for their own comfort instead of abiding by the doctor's orders. For example, feeding an intubated patient a hamburger because he's hungry when they're already getting tube fed, and ordered not to interfere with a vent or trot. This has resulted in many patient deaths than you think. 10th surgeon here. We listen to music in the OR. Most people seem surprised when they hear that. 11. It's likely someone died in the bed you're sitting in.